that I don't show a lot because I don't want you stealing it from me. Because if you do this incorrectly, you're going to leave people with lumps and bumps, and then I'm going to have to fix it. We have a very fit male, works out, takes peptides. He basically does Codex protocol, you guys. But if you're following Recodex system or Jason Emer official, you know I work out a lot, and we are now advancing to a new system where we do combinations of things you've never seen before to get people basically the most fit they've ever been. Actually, to a point where people from the Olympia contacted us yesterday to be one of their people that talks about how you could do this stuff almost as a sponsor. Okay, so I want to show you something. Look, just kind of crunch. You don't have to like sit up as much. But we're building out his abs because he doesn't naturally have huge abs that he can see. But you see, he's fit, right? So what are we doing? We're doing superficial and deep, we're going to relax, injections of fillers that will build not only the tissue permanently, but also his muscle. And if you combine that with things like IGF-1 and internally CJC, tesamorelin, you will get, or even kisspeptin, which will increase your testosterone. It's a lot you can get beneficial-wise, really being optimized. And that's what it is. Remember I said, you're the lab, we're the code. We can give you guys exactly what to do as long as you allow us to direct it. And so here we're gonna do a little bit of a mixed filler hybrid where we're doing PMMA mixed with filler, and this is on his fascia. So this is gonna permanently integrate into his muscle almost as if it was fat, and we can do it with fat. There's a new fat that's come out, and actually we're gonna be doing a fat hybrid called with aloe clay. You guys will see that very soon. I'm gonna come over here and go ahead and sit up, crunch again. So now we have good separation between the muscle, and we're gonna build out a little bit more onto the muscle where he has some deficiency. And you guys are gonna see major differences in the structure of his abs as he works out. In the old days, we used to do this with ultrasound because we were nervous about harming someone, but after years of doing this, I realized you can't, you really can't. The only thing you can do is mess up the cosmetic look. So you make sure you go to someone that knows. Go ahead, relax a second, how to do this. Okay, PMMA, hybrid filler, helps him, and then internally, he's gonna be doing his peptide plans as well as his testosterone plans. And why not be the most fit you can be at any age, but when you're in your 40s to 50s, things start going downhill. You guys need to, it's not just about getting a cosmetic procedure done. To have a good body, you want to make sure you're working out to feel fit, healthy, have less pain as you get older, and better sex life. Why not? Why would you want to have worse sex as you get older? That's one of the things you want to do. So it might not look good at the same time. Anymore? No. That's it. All right, so now let me show you guys real quickly how it looks. We're going to wipe everything off. And obviously we could do more, but this is a really good starting point. I think because it didn't have as much of those borders at the beginning, he's gonna really see a big difference now, and it's gonna lock him in. And so we're gonna get some good selfies, I know it. I already can tell, because like you could see the result immediately. But again, it always looks, again, a little more lumpy at first. Now it's actually not too bad. And it's gonna blend in really well. So I'm outlining it, making sure it's shaped properly, okay? Because these are thicker fillers. These are things that do not migrate. These will stay, and they're very safe. Now, obviously, with any filler that's not injected in the place it was intended for, this is an off-label use, and you gotta trust the physicians you go to. Not many people I know how to do this, okay? So now, again, just kind of crunch so you can see. There we go. So now I'll take a look at the abs that we've created, and what I'm gonna have him do is kind of like this over the next few days. Just kind of rub, in between. We used to do this foam pad. It doesn't really make a difference, to be honest. But look at the difference already, you guys. He has abs he can see, much more prominent and better and more in comparison to here. And eventually maybe we build out a little bit more because this area of his skin, it's just the way his muscle is, it pops out. But by elevating the edges, you really can see. So pan for them. This is true gladiator, you guys. But in the new form of what I'm doing, I'm gonna shine from here, I'm gonna show you. This is what we call the Syntorque procedure. And you guys will learn about that very soon when our new website comes out. And so check out Recodex system, and if you wanna be optimized, definitely give us a call. Let me show, here we go. Why not? Show it off. Show it off.
It was great.
And then come back, pan back, like all the way up, like 45 degrees. A little higher. There you go. Show his body. Like here. Go leg. Go in here. There you go. So you go like that. He's ripped. It's crazy.
Wow.
So now we get him back to the gym. All right, go ahead and relax this sec. And that's it. So we'll go here so you guys can see the end result. Perfect. All right, you got it? Perfect. All right. Good. All right, so I'm going to put you under the red light, but this should be great.